It's spelled like lime, but it's Lynn.
Madeline,
I
got it.
feel like professionally, like online, I don't know why I definitely go by Madeline, but in real life it's much more Maddie. I changed my name actually when I got board certified because not everything would fit.
Oh my gosh,
And then
yeah.
people started DMing me Maddie and like
It's
felt weird
different.
to me.
Yeah.
I was like, no, never mind, guys. I can't.
So we're back to
I was
Madeline.
like, I don't know you like that.
Right.
So.
We're not there yet, so.
Yeah, exactly. So yeah, very much Madeline online anyway.
Good to know. You give me such a Madeline vibe. I feel like Madeline is such like a pretty, like chic, like very, I don't know, I feel like it matches your style because I love your sense of style.
Oh, thank you.
Alrighty, so you guys, I'm so excited today. I have Madeline here with me. Madeline, first off, I need to hear, how was New York Fashion Week?
It was so fun. Steph and I actually went. She's one of my actually very good friends now from Connecticut who we just randomly connected in the DMs.
Oh my gosh.
These days.
Wait, no way. Really? That's so cool.
Yeah. I forget who reached out to who, but we were essentially like, hey girl, we're both small-ish but big-ish bloggers, if you want to call it that, in CT. Like, do you ever want to get together? And now we're like full-blown best friends. There's so many weird connections too. Like her grandmother's name, like her ride or die grandma's name is Loretta. And when she told me that, I got full body chills. My grandma, like, rest in peace, she did die a few years ago, but died at 92 of pancreatic cancer, never cried a day, was always like a bad bee, taught me like all the things. My dad is the way he is because of her, and so am I. And when she said that, I was like, Steph, no, like my grandma's name is Loretta. So we're gonna be best friends for life probably.
That is insane.
Yeah, so she went last year for the fall, which is definitely a lot bigger. And we didn't go, I think, technically, officially when it was happening. We kind of went like the tail end for the weekend.
Got it.
But it was still fun. Like so many fun events going on. New York is such a different vibe. I honestly haven't been back for any content or anything like that since I was like a kid, really. I mean, high school, etc. Kayla, my quote-unquote sister-in-law, got her wedding dress from there, so we were there for that, but like not in the sense of a trip where you're like shooting photos literally in the middle of the street. As soon as the light turns red, I'm like, people are savages out here. So it definitely had to bring out some confidence in me. Steph is that way already, so I love doing stuff with her because she's like a hype woman for sure, but I need that because I do not have that in me.
When you are doing these like photo shoots and stuff, where do you change? That's my biggest problem.
So for literally New York Fashion Week, and again, this is all Steph, but I was very into it. She said when she went last time, her and the girlfriends that she went did this, but like everyone else and their mothers was doing this too. Literally, travel suitcase, roller, walk around with it. Literally, we walked around miles with our cute little suitcases. Thank God mine's cute. We moved them all around. And then obviously, like in Connecticut, I mean, we'll bring like a duffel or a big purse, whatever we need to. But we typically will always get like coffee or breakfast or something like that. So we'll probably like shoot before, then we'll go have breakfast, then we'll change in that bathroom, and then we'll go do another look, etc. So
that's so smart to like implement like where you are.
Yeah, it's like, oh, I have to buy something to use the bathroom. Don't worry, I'm going to get an iced mocha latte anyway. We're going to sit over here, and then I'll use the bathroom maybe twice. Thanks.
Oh my gosh, she's a vlogger. That is like so cool.
So it's always very fun.
Was there anything stressful at all about like New York Fashion Week? Like, is the vibe super hectic when you're there?
I'm sure it's a lot more hectic when like everything is happening itself. And I know when she went, like they had so many different events. I mean, even what we were trying to do was just like 2 different events in a day, but we wanted to shoot beforehand, etc. So like your day definitely gets packed, and there's not a lot of time to sit there and be like, well, can I have 50 more photos of the same outfit? You kind of have to like go.
Right.
I know when she went last time, she got up super early, did all the things, but as long as you're like organized about it, it's still pretty good. But I mean, she crashed when she got home the last time, and I crashed when I got home this time. Not even from like everything we did. It was that, I mean, we watched so much, etc. But it was also just like, that is not my usual bedtime. It was so late. So it probably took me a full week to recover, which I think just shows that I'm almost 30. It's embarrassing.
No, I don't blame you at all. Hold on, I need to put Ellie in the bedroom because she's just like barking too much. So sorry about that. One
That's
second.
okay.
Ellie, come on. Come. I know you want to be a good guard dog. You don't need your services. Come on. I know. I'm sorry, hon. Oh my god. She's like so mad right now.
I died. We don't need your services.
Oh, you heard that?
Yeah.
That's so funny. Oh, yeah, she's like so mad because I literally just came home in like the middle of the day. And she's like, "Oh my god, you're home. What are you doing home?" And then I just like went straight to my desk and she's like, yeah. Let me just make sure she doesn't claw down the door. Might take a second. How's everything going with Ghost? How old is he now?
Ghost is almost 2. He'll be 2 April 20th. 20.
Oh my god.
It's
Wait,
not
that's
my
when
vibe.
that's when we adopted Ellie.
Oh, that's so funny. That's literally like his birthday, and then we got him in June at some time, but I remember reading that on his birthday.
Yeah.
And I was like, all right.
That's so
Sure.
funny. What an iconic birthday for him.
I know. I'm like, it's not really our family vibe here, but that's okay.
Yeah, that's
like,
fine.
I'll remember. It's also by Earth Day. That's better.
Yeah, Earth Day. We'll think of it that way.
we'll go with Earth Day. But yeah, he's really good. He's like a very, very gentle, like well-tempered dog, which is amazing. Even though he's not neutered yet, like we'll go to the vet and stuff. And I mean, now the vet techs know, but we had like a new one the other day, and she was like, "You were just so nice. I thought I was going to have to muzzle you because I read you weren't neutered, but you were just such a cutie," like all these things. So he's definitely very well, like, mannered and everything like that. He, for sure, is a guard dog, like, if you just were to randomly walk up to the door, etc.
Yep.
But he's very used to, like, UPS men now. I mean, all the packages.
Yeah, all the packages.
But, yeah, he's really good. We're going to get him neutered in probably a month or two, so, like, around his 2nd birthday, which our vets were saying, since he's like a larger breed, is better for his like
The joint
joints.
development.
Yes.
Got it.
Yeah, and like I think bone health overall, just with a larger breed, they like want the hormones in the body longer.
Right.
And he hasn't been aggressive. He doesn't like hump people constantly, so it hasn't been something where we have to neuter him. I know some of our friends. One of our friends has like a baby, like a toddler, and their dog was like knocking him over and trying to hump him, and it was like, all right, we're gonna have to neuter you before a year, just given the circumstance. So we haven't had that, which is nice.
Oh my god, that's so funny how dogs do that. That happens to not well, Ellie's a girl, but at the park there's a lot of male dogs that like haven't been neutered yet, and they're just like humping everything in sight, and it's like so funny but kind of embarrassing too. But yeah, okay, I think she's good, so.
Okay.
All right, so my biggest question for you is, it's been really fun to see your journey. You know, you started documenting everything when you were still in pharmacy school, right?
Mm-hmm. Yeah, I think it was like my 5th year.
Yeah, and then I've seen you go through, you know, like residency and now this new job position. You recently changed jobs actually too. What do you think really led to this change, and like how is this adjusting to this new job been?
So originally when I made the first change into AmCare, which was January of last year, I was elated. I was so excited. I've kind of always wanted to do AmCare for the most part. Very much wanted, like, you know, the typical Monday through Friday schedule, just with everything else I have going on, scheduling stuff on the weekends, etc. is so much easier. And just like knowing, oh, I'm not going to have this random evening shift and all that stuff. And just clinically, it was also what I wanted to do a lot more. And it was in endocrine half the time, which I love diabetes, will always love that, and like really liked the disease state. So I was super thrilled. And then it was probably, I mean, it was very quick, probably like 2 to 3 months in, that I was like, oh, this is kind of taking like a bit of a toll. It was about like essentially a full hour drive each way.
Oh,
and then, yeah. And then with, especially on endo days, I would have to do a lot of pre-workup because I would have appointments back to back to back, and there was no time to like look up the next patient afterwards. After you just had an appointment, you're like, when am I going to write my note, etc. So then I started having to come in early, and then I was leaving late, and it was just a lot of I think like burnout in the sense of just like the schedule aspect itself. Like I loved what I was doing, but I knew that especially with like becoming a mom one day soon, or like I don't know, transitioning any part of my life into like thinking more of family and stuff like that, it wasn't going to be something that was sustainable. Even though I clinically really liked it and loved the people I was working with, it just wasn't going to be something that was going to work for a long time. And then so I'm in a health system that has, oh gosh, at least 5 hospitals, maybe a couple small ones too in the mix. And I used to work at the largest of the chain. So I have a lot of connections just within the system itself, and our AmCare department overall has been expanding. So then I started having meetings about that manager becoming technically my manager, which wasn't really the case at the time. I was under that like smaller hospital for like a, official supervisor, et cetera. So as that stuff was happening, we're kind of having these like check-in meetings and like, how are you doing? And they were definitely, thankfully, people that I felt really comfortable, like, truly telling how I was doing. And essentially, they found me a new position that was opening up anyway, that I could apply to, if I wanted to. So now I am back on the largest hospital's campus, which still is probably like 35 minutes of driving, and then you add the garage commute, etc. It's like much more city-like, but it's still a lot closer to home. I get a work from home day every week. It's just a lot more balanced. I don't have to be in right at 7:45 or 8 a.m. because I don't have appointments. I kind of schedule everything out. It's mainly telephone calls, etc. So like every aspect of the job is more flexible and just works so much better for work-life balance. So while originally I was like, do I like movement disorders? I don't really know. I have found that I do love it, and it's still very fulfilling, but it's definitely different than what I was doing. But I think just for like full life picture, it's a lot better.
How do you think you can tell? Because like, I think at least I know a lot of people out there in their jobs, they are having like similar kind of challenges. How did you discern though? Oh, it's like all of the other factors like the commute and all of that. And instead of thinking like, oh, I hate this job, I want a completely new job.
Yeah, I think it's different for everybody. But I think like when I have thought of burnout versus like maybe something's just frustrating, it's like a sustainability thing to me. Like, is this month just hard because I have a resident, or because, I don't know, we're building a new clinic and we got displaced into this other, like, is it a temporary thing, or is it something about this particular job at this particular place that just isn't going to work full time for
that
my
makes
life?
sense. Do you enjoy having a resident with you?
I love having students and residents. I think in every job it'll be a little different. So like when I was in endo, it was so nice because I got to have them, once they were trained enough, I got to have them do the vitals and take their weight and go download their glucometer while I was sitting there and trying to write my last note. So it was very, very helpful in that sense. And I think just diabetes is one thing in particular that is just very like rewarding to learn about, but also like for the patients because it's just so impactful on their health. In my current role, I haven't had any students or residents yet. I'm about to have one starting March 1st, and then we have a resident in May. Given the fact that we're all like a lot more remote, so we're not seeing patients in person, etc., we are going to split the rotations up among like a couple preceptors so they can kind of see multiple disease states and multiple clinics, and they're not just like sitting next to you all day long. But who knows if we'll change that, because again, we haven't had any. But yeah, overall, I think students are really great to have, and it's great to like give back to people. Granted, I mean, obviously there's many different types of students. I know I was a super hardworking, people-pleasing one, and then you have other people who don't care as much. You kind of have to like not have super high expectations all the time and get that like maybe your rotation just literally isn't something that this person wants to do at all. Right. But for the most part, they're all great in their own way.
How do you think, so I have a couple friends out there that actually are looking for new jobs and trying to switch positions. What is some good advice that you can give them? I know you leverage your network, for example, but is there anything else that they can really do to find more resources and opportunities?
Yeah, so what I love to do, right, like you said, leverage what you already have available to you. So a lot of hospitals nowadays are in some type of network. So trying to connect with pharmacists or managers, etc., from the larger branches is a great opportunity. But like even just, which I think as soon as we get out of school, we kind of get out of this mindset, but like organizations, like for the most part, every state has an organization. I think we have at least two in Connecticut. One I think is more tailored to like retail or just general, and then one is like a health system. But those, I mean, you have people that are actively participating in that from probably every single institution within your state. And so, especially if you're looking to stay local, that's a great way to connect with people. I have always had the mindset of, I'm not going to be able to get a new job unless I show that I'm a really good hard worker and like good in this job. So I think just maintaining your like reputation is huge. When I was leaving residency and trying to apply to the larger institution, my preceptor at the time literally wrote the director there an email saying how much I had helped throughout the pandemic, how he couldn't have done all these things without me, highly recommends me, etc. And that same director that I then was working for, I know has advocated for me for many positions and things like that. So just kind of being like well known and being, and like well known in the sense that like that person's a great pharmacist, that person really cares, that person works hard, that person's reliable, like that goes so much further than I think people realize a lot of the times. Because even if you aren't experienced in X thing that you're applying for, if you're known as that type of person, they will know that you can get there because you care enough to get there, sort of a thing. So I think that's really big. But any job, like if you have a specific job that you want to get, like let's say it's, I don't know, like what I'm doing now where it's like it's AmCare. I always tried to do outpatient AmCare related things no matter what like job I was in. My presentations were focused on outpatient meds, etc. I volunteered to help start like a transitions of care program or pilot program. It never actually got approved, but I was doing a bunch of things. Yeah, and I was doing a bunch of things that kind of showed like, oh yeah, for years Madeline has wanted to do AmCare. But there's also like when we had people applying for some of the jobs that were open before I was applying to my current role. Someone was coming from retail and she was a manager, but she was doing enough counseling and things like that that she was able to take the BCACP before she even ever got into traditional AmCare. So like that shows so much like gusto and like really wanting to change jobs. There's so many ASHP certificates and so many things out there that are tailored to like specific niches that, I mean, the ASHP certificates, like you don't need prior experience or anything like that to get those and earn those. So there are a bunch of things that you can do to show that like you're actively working towards whatever you want, you know, whatever it is that you want. So I think things like that too just kind of show that like you really do want to change for like that clinical job versus just wanting a better schedule or whatever. So you can kind of like justify it a little more.
Yeah, I feel like it's super impressive what you said about how like, I mean, first of all, that's so impressive that your program director like literally wrote to like that hospital. That's like so cool. But I think it says a lot about how like even though like if you're in a position where you know you're not happy, if you still show up and work hard. Because I think a lot of times, like, working hard, being attentive, being that good employee is, like, the first thing to go when you're not happy in a job anymore. Because, like, you're burned out.
Which is never going to help you in the long run, unfortunately.
Right. That is such a good point. It's so good to hear someone else, like, frame it that way. And that's kind of a good mindset is to have, is, like, in order for you to get out of your current situation, you have to, like, crush it at the current situation to up-level.
Yeah. And even if it's not, like, within the same health system, I have heard this so many times in school and I used to roll my eyes at it, but it could not be true. Like pharmacy is such a small world. You can't burn a million bridges here and then expect here to like go get this great job. One, all jobs want like references, but like even people like this morning we interviewed someone and I was like, oh, hey, I did residency at this hospital that you're per diem at. Like wink, wink, I know people, you know, it's like, you have to think that like everyone has connections, especially in a field. I know our field feels big, but like it's really so small at the end of the day where everyone kind of knows everyone, like whether it's someone you went to school with, like there's so many connections out there for people to check in on like the type of worker, the type of person. Like that's what my dad always tries to tell me. Like when I didn't match in phase 1 and then went into phase 2 interviews, one of the biggest things he like gave me for advice was like thank them for their time, tell them how grateful you are to be there, like show that like you're like humble and happy and like just so grateful to be there. And that goes so far, just like showing that you're like a good, genuine person, which has always helped so much. So if you like interview someone and they're just kind of like, oh yeah, yep, thank you, it's like, it's fine. But if it's someone who is like, thank you so much for taking the time out of your day, this was so great to talk to you, they send a follow-up email, etc., like that kind of extra step of like humanity just goes so far.
For sure. And I have to say, I really commend you. I remember when you first posted about your experience doing like the phase 2 step and like not matching phase 1. I just thought it was so awesome how vulnerable you were because so many people out there relate and go through the same thing. And it's like really like so part of the process. But for some reason, society makes everyone feel like they have to like match the first time, do things right away, like succeed.
Yeah, like you can never like being successful means that you never failed, which is like not the case.
Yeah.
But thank you, because that was probably the scariest post I've ever posted online.
Oh my God.
It quickly became like, oh, okay, wow, yeah, like so many other people needed to hear this, and it ended up being a really great thing, but I was so scared.
Yeah, what was going through your head when you first opened the email and you saw like that you didn't match right away? What was your first thought?
I don't even know. So it's so funny because like I in school was always, I was in a million clubs. I wanted the 4.0. Like I did everything I could have possibly ever done. And Connor was always much more relaxed, which is fine, but it just wasn't like, it wasn't my vibe. I literally used to roll my eyes at him when he would say things like, I don't live to work, I work to live. And I'd be like, lazy. Like, okay. Like, how's this gonna work?
I'm dead.
And now I'm like, oh, honey, thank you for that attitude. I'm like, I get it. But no, so we had him open his email first because, like, he was prepared not to match. And for whatever reason, like, we didn't think I wouldn't match. I don't know. Fools. But so he matches to, granted, it's like the place he works as an intern, like, you know, it was a very good like situation for him. And then I open it and there's no big like bold congratulation, and I'm just reading, and then I'm like rereading, and I just was like, I don't even think I had words. I think I was just like stunned.
Yeah. The woman was too stunned to speak or whatever that like TikTok audio
was like, I just kept rereading, and then I think Connor took the phone from me and then was like,
oh,
I don't know what to do. Yeah, we were both like, well, okay. And I truly, like, I literally was miserable for the next month. Like, poor him, I'm sure. Like, poor anyone that spoke to me, because I just literally thought my life was ending. It was like, I did all these things, and, like, what am I going to do? Where am I going to work? I'm like, it was a hot mess.
What was the next steps then in terms of like finding out you didn't match and then like that like month of sadness for anyone that's also kind of going through the same thing? Or I don't know how the timeline necessarily works. I think pharmacy match is actually coming up, so this will be a good episode for anyone that's about to go into it. What do you do?
I think right now people are still interviewing, or at least I think our hospitals are still interviewing.
Yeah, I think so.
And then I think match day, like phase 1 is typically March,
like March
15th, or like like mid-March. And then I think the second match day, I think it's in April. Phase 2 is very, very quick. So, like, you only have so long to be sad. I definitely cried all Friday. I did not go into rotation. We went out that night. I got a drink. I got some good food. And then, like, Saturday morning, Sunday, I was looking online. I forget when it opens. I think it's later that day that it opens the programs that are available for phase 2. Again, everything's very quick. Redid all my letters for there, updated my CV with all like the recent stuff, because when you're applying in, you know, December, you typically have at least 1 or 2 more rotations and things that you can add on to your CV. So I did that, applied to everything that I could, and whatever deadline the match system or forecast gives you, like, be well before that. I know programs that got so many applications in phase 2 that they shut down their portal, whatever, but like well before the deadline because they literally didn't have the staff to look through that many applications. So they had to cut it off. So being like early to reapply is really good for the programs that are left. Because like to put it in perspective, granted, I don't know how many residency spots Connecticut has overall. There's at least 20 at a big institution, then there's at least 6 at my big hospital. There's a really good amount, like overall, maybe it's close to 40, who knows, spots. For phase 2, there was 4 spots my year.
Oh my God.
So
that's crazy.
2 of them were at the same place. One was at a hospital that I didn't get an interview at in phase 1 and then didn't get an interview at in phase 2. So then I had 3 spots I was going after. Again, 2 at the same place and then 1 where I ended up matching. So it's a very like high stress, high stakes situation. So you really have to find it within you to like remain calm and just be a go-getter and like show up and be prepared to say like why you deserve it out of the hundreds of people who are now left.
And so everyone's like a little hungrier too because it's like phase 2.
Yeah, so I think that's again where like a little extra humanity and like really being thankful, etc. is a very good thing to have in that. But at the end of the day, again, I now know so many people who never did residency and are so successful or have jobs that are literally the same thing as somebody who did a PGY1 and PGY2. So your life does not end.
It's so good to hear.
Yeah, like it certainly can feel that way. And it's definitely something that I think people are talking about more now, just in terms of like the numbers and like the real situation out there and everything like that, which I think is great because then people don't have the whole expectation of, well, oh, if I didn't do this, then I'm a failure, like I originally felt. So I'm really glad people are talking about it more.
Are you, looking back on your experience with your residency, are you thankful that things worked out the way that they did and you ended up where you were?
100%. 100%. If I had been at either of the other places, I'm sure it would have been fine. But like, even just with the pandemic stuff too, like I got to do so much in the pandemic because we were such a small institution. It literally was like me, 2 of my preceptors, and one of our managers doing 99% of everything. And while that was like its own sort of burnout situation, I will forever be a better human being, a better pharmacist. I am so close to those people. Like it was a really good time, even though it was a really bad time. And I think just like everything that's happened after that and the positions I've had and things like that have just always been, I think, exactly what they were supposed to be. So yeah, I'm definitely thankful for everything that happened, even though it wasn't fun originally.
The universe is like so crazy because I feel like sometimes it's kind of like what we think we want, like isn't even best for us, but we can't possibly conceive that there's even bigger and better out there. So we're like, okay, we want this choice. And then the universe is like, no, this one's better. And you're like, but... And then you have to like let it pan out.
You don't know that other thing is there yet, and so you're like, "What do you mean?"
Yeah, I'm like, this was it.
Yeah, exactly.
If you had to describe the field now that you work in, so ambulatory care, to someone that doesn't really know what it is, how would you describe this field?
I first try to tell people to like think about like their doctor's offices, like their PCP or something like that, because a lot of us are located within some type of clinic. There are pharmacists in AmCare who work in primary care and just kind of like generally help out with most disease states, but generally it's like diabetes if you know that person's only seeing their PCP, or hypertension or hyperlipidemia, things like that. An endocrinology clinic, again, I was in one of those, an anticoagulation clinic. So most of the time that's people on warfarin because they need so frequent INR checks. If you're on like one of the DOACs, you obviously don't need like as much follow-up, but you can be in so many different things. So there's like the clinic-based settings like that. And then one of the things that I think is kind of like rapidly expanding now is kind of the telehealth kind of specialty pharmacy sort of thing. So our positions right now are all justified based on 340B savings, which isn't what we want in the long run, in terms of we would love, you know, our institution to like just justify them and know that we have them based on just the clinical stuff that we can provide. But obviously at the end of the day, health systems need to like make the money back and pay for these positions and whatnot. So we've justified them all through that. But I'm doing movement disorder. We have 3 GI pharmacists. We'll have now 2 rheumatology. We have 2 endocrine, 1 primary care. I'm probably thinking or not thinking of something, but a lot of different areas. We just opened dermatology as well. So any of those specialty medicines, obviously a lot of them are like monoclonal antibodies and injections. Mine are not, just based on like the nature of my diseases, but those I think are rapidly expanding a lot and are a great niche for people. We're kind of all on site, but one of the other large institutions has very similar positions to us, that for the most part, if it's those kind of specialty like pharmacies, they're all working from home. But then again, they do have a bunch of people that are in their general clinics as well that are like the more traditional clinics. So I think AmCare as a field overall is just like rapidly growing, which is really nice to see.
So I know you mentioned earlier how like initially you weren't anticipating how much you would actually end up liking movement disorder. Or movement disorders. What like surprised you that you were like actually really interested in it with?
So I think like just right off the bat, I mean Parkinson's, etc. Like that's not something I've thought about since school. Like it's just not something that we really get a lot inpatient, or really see other than like a very specialty neurology clinic. So I think in that sense, I was kind of like, I don't know. Yeah, like that one lecture that we had in school was okay. I guess, yeah, you know, like
that
I really
PowerPoint?
thought about it. Yeah, that one PowerPoint. But I think it's too just like my patients sometimes are just so inspiring. Like they can have the most advanced Parkinson's or crazy ataxia and in these things that like literally prevent them from moving, like being able to walk, being able to move normally, and just to hear them be so positive and have like such a good outlook sometimes, I think it's just like a nice wake up call to me and like my own life. Like I can walk, I can exercise, I can. And I even kind of had that mindset switch in endocrine where like, you know, so many patients were so ill that like I couldn't just tell them to increase their exercise because they literally were wheelchair bound or they've had amputations or all these things. So I think that, and unfortunately with Parkinson's, obviously it's kind of not as much, not that diabetes is anyone's fault, but it's a lot less lifestyle created. You know, people can just like genetically have that risk and be more prone to it, and you know, be like, I've had patients who their wives are like, you know, they hiked all these mountains, they were so active, they this and that, and like now we're struggling with this, and it's so heartbreaking. But for the people who are still able to like maintain such a good outlook, it's just really inspiring that like the shit that I'm dealing with is not big.
Yeah.
And just I think switching my own like mental health and like physical health over towards more of like a gratitude state and like I get to do this and I can do this has been really nice.
You know, talking about like mental health and like lifestyles and all of that, I remember too in a recent post you mentioned how you'd made better, healthier, happier lifestyle switches. What are these switches that you've made?
So before, I would say like just overall perspective, in pharmacy school, I was not healthy. I ate like frozen pot pie. I ate like whatever was quick and easy. That's what I did because I wanted the 4-0. I was busy. I had this, I had that. The best thing I was doing for myself was probably the fact that I lived like a 20-minute walk from school. Like that's all I had. I rarely was in the gym. I just didn't take care of myself in that sense. And I'm sure if I had, I probably would have felt like a lot better. When I got later into the years, started dating Connor, who was a lot closer to our like school gym and things like that, we started going a little bit more. But my appy year, where I don't know why, because like appies are pretty similar to kind of real life work.
Yeah.
Like, you have to go every day. You even have homework after. But for whatever reason it was, and it maybe was just that we were both on like the exact same schedule. We went to the gym 5 days a week, like every single night after rotation. Connor's mom at the time was on a health kick, and so we were eating really, really healthy. And I was in like the best shape I've probably been in at that stage. And then residency hit, and even post-residency, pandemic, schedules all over the place. Like, I just never was showing up for myself on a daily basis in that same manner again. And I tried to, when I transitioned over to the original AmCare job, I would try to get up in the morning, get on the Peloton, etc., and then go drive the hour to work. But it just wasn't sustainable. Like, I think I was just so tired from the commute and like that kind of like burnt out feeling that I just couldn't sustain it. And then when I switched into this job, it took me probably like a month and a half, but I every single day was thinking like, our gym is literally in the first floor of this building. What are you doing? Like, it's right there. It's right there. So I now go in. I try to get there at like 6:30. I mean, the earlier the better, but I also need my sleep.
Yeah.
So we'll get there, like, let's say at 6:30, and then it typically takes me like an hour between. I'll try to walk ideally 30 minutes, but if I get there late, I'll do less. And then I do some form of like weights and like muscle group each day, and then we shower. Thankfully, my coworker, like, we share an office. I don't know what to call it. I thought I had a better
roommate of worker. Yeah.
Yeah. She is big into fitness too, and so she was going to her gym, trying to beforehand, but now she goes to this gym too because it's just easier. Like, it's easier to commute early and not hit traffic and then be on campus already and kind of do whatever you need to do. So we both kind of work out for an hour. We shower, we get ready, we walk upstairs. Like, it's a good setup in terms of like where the gym is located, and it would probably be a little harder to maintain it if it was further away, but it could be done. Like, I think those years after residency was always trying to do it at night, but between the emails and the trying to do content or having to post something or having to respond to someone, or like, I love to cook dinner, so I want to be the person who cooks dinner, all those things, like, you only have so many hours when you get home, and it just wasn't something that I felt like I could keep fitting in there and like still get everything else done and have time to relax and spend time with Connor and Ghost. So I started just doing it every single morning for myself, knowing that it wasn't benefiting anyone else but me. And it's been great. And it's been like a great switch. And then, by the time I come home, like, that is done with. My health is done with. I've taken care of me for the day. I make a nice dinner. And then I get to do whatever else I need to do.
What's your favorite dinner that you've been making recently?
Oh, that's a good question. We've been trying to eat healthy in general. Once over the summer, which I like kind of recreated this, I got this like corn-breaded cod and like had this delicious creamy sauce with it and this like couscous little salad thing. We stopped doing the couscous because I was like, sweetie, the cornbread is a like, carb.
Yeah, so right.
We don't need all this rice you just made, just so you know.
That's how Jimmy cooks too. Jimmy's like just like carbs everywhere.
yeah. I'm like one carb. I'm like the endo thing's still in me. Just one carb at every meal. Okay.
Yeah, I know. It's all because of endo actually, because like I didn't even work in endo, but like just from pharmacy school, I feel like learning about diabetes and everything. I'm like, it's like set in my brain.
Yeah, and we had nutritionists like right in our clinic, so I would get to sit in with them sometimes. And I'd always be like, what's your favorite bread? What's that? I'm like, tell me all the things for me. But yeah, I definitely loved anything we cook is like very therapeutic. I also have been loving like a minestrone soup for whatever reason. Anything I can put my Parmesan
the rind
cheese in.
Yeah.
I will do. Like,
oh
if
my
I can
gosh.
put that cheese on it, I'm good.
Yeah, that's my new favorite thing. This is like such an adult thing that I started doing in the recent years is instead of buying shredded cheese and stuff like that, I like got a cheese grater and I like freshly grate cheese now, and something about freshly grating it in my head makes it taste better. Oh,
always.
Yeah. So last question, out of all these, lifestyle changes and having just a happier, more balanced life in general, what is like the one non-negotiable in your life that like you have to do or you like really, really care about the most if you had to organize it?
Oh, let's think. It's hard because I think that physical activity always makes me feel so much better. But I'm a huge girly girl, and at the end of the day, like, I love my skincare routine. I love all those things. I get my eyelashes done. Like, I do the things that like help me on a daily basis. But if I really had to pick, I would still probably pick physical activity. If that was like, if I only got one.
I'm proud of you. Because I know the skincare is hard.
Yeah.
So follow-up question, because I'm like, oh, I know that was the last question, but now I have a follow-up question. Let's say you can only choose one item in your skincare routine. What's the one item you're choosing?
Oh, to keep?
Yeah, like everything else has to go. I'm so sorry.
Ooh, that hurts.
I know, I'm so sorry. Now I'm like, I feel bad.
I would probably pick my vitamin C serum just because I think like long-term vitamin C has so many benefits.
Which one are you using?
I love Tatcha. I'm a Tatcha girl. My cousin uses it too. She originally got me hooked, but I've been using it for years. I only buy it on sale, so either like the Sephora sale or they also have an annual sale where it's at least their sale may be sometimes 25% off. Sephora's like 20 max. But I only buy it on sale. I stock everything up. I use their Essence like water. It's kind of like a toner water, but it just feels so hydrating. Like I have dry skin and I love it. Their rice enzyme powder is the best like exfoliator I've ever found. Like it just leaves your skin so it's first of all, it's what has kept all my acne away. Like I don't typically get a lot of acne, but I will get stuff if I'm just not exfoliating enough.
I was just gonna ask, like, do you naturally have good skin? Because I'm like staring at your skin right now, and I'm like, it is so good. It's like glass. It's like
to be honest,
reflective.
I had such a rough morning that I haven't even washed my face today.
What? Stop! It looks so good. It looks so
really
good.
It's probably just the camera quality.
Either way, I mean, this is gonna be video, so like everyone take a look. It looks great.
Yeah, no, and you can tell I have nothing on because I'm getting so red with my laughing.
Oh, I can't tell.
Oh, really? I feel like I look so peachy over here.
I think so I don't know if it's the way that the platform is. I think like our videos of ourselves are clearer than the other person's for some reason. But maybe once I edit it, it'll be different, you know?
I don't know. You look very clear to me.
Really? Okay, maybe it's better if it's less clear because I'm having a bad skincare day. So like, let me just back up. It doesn't
look like it.
Thank you.
No, but yeah, that stuff has always just worked really well for me, and it feels luxurious. Like it feels nice to do, which just keeps me wanting to do it more. So
got it.
Yeah,
that makes sense. Well, that's all we have time for today, but thank you so much, Madeline. This was honestly such a fun conversation. I'm so excited for everyone to hear your tips, and I feel like just your story, your like ups and downs and everything that you shared, like you were so vulnerable, and I really appreciate it because I know so many people are going to find it so beneficial and connect with that. But leave all of your information, all of your handles where everyone can find you.
Okay, well, first of all, thank you for having me. This was lovely. I had a lot of fun, and I hope it is helpful for people. So if you guys want to learn more, find more, ask me questions, etc., my handle is the Lux Pharmacist. It is on Instagram. I'm trying to get bigger on TikTok, so if you guys were to follow me on there, I would
follow her on there.
I would love you all. I'll be more fun there, a little less professional. For some reason, I care a lot about like the aesthetic of my Instagram page, but I don't really care about the aesthetic of my TikTok page. I don't know if people have a similar vibe to that.
Yeah,
but I'm not thinking as much about like it fitting into certain categories or it being something I normally talk about. So I don't know. I'm just picturing a lot more fun stuff to come there. And then my website, my blog is The Lux Pharmacist. Everything's The Lux Pharmacist. So theluxpharmacist.com, theluxpharmacist@gmail, whatever you guys got. The Lux Pharmacist.
Yeah, just send her a Gmail. Alrighty, well, thank you so much for your time, and thank you so much to everyone that's listening. I will see you guys next week. Bye. Let me just hit the
Bye, thank you.
Of course. Let me just hit the stop.